Good evening. Let's deal with a commonly asked concept in squint, which is diplopia versus confusion. Let us first understand what it means to have retinal correspondence. So, retinal correspondence basically means that each point in one eye is going to have a corresponding point in the other eye at the level of retina. So, these are basically coordinated areas which are present at the level of occipital cortex, because of which there are going to be corresponding points of each retina. So, suppose there is a point on the left eye of the left retina. There is going to be a point on the right retina which it corresponds to, which is going to have the same angular distance from the fovea of that eye. So what do I mean by that? Suppose there is a point in the left eye, the angular distance of that point from the fovea of the left eye is going to be equal to that of the right eye. And an imaginary line drawn between these two points is called a horopter. Such points always occur in pairs, and the most important obviously is going to be the fovea, because that is the point of maximum visual acuity. So please remember, the fovea of the left eye will always correspond under physiological conditions to the fovea of the right eye. So looking at the image, suppose I want to see the image of this house that I'm showing, then I will fixate on this object by putting both fovea in the line of sight and bringing the object in regard, which is the house, in line of sight, and the rays of light from this house are going to reach my left and right fovea, because these are the corresponding points. And although these are two different images from two different eyes, a fusion of these two images is going to happen at the level of my occipital cortex, and this image will be seen as one. So I am seeing this single image because there is a phenomenon of retinal correspondence between the two fovea. So now, for example, if the image is placed to one side, it was not at the center, it is towards the right of the screen. So my left eye's temporal retina needs to be stimulated, because now the image has moved to the right side. So naturally my eye has to turn inwards such that the temporal region of my retina gets stimulated. And opposite to that, in the right eye, my nasal retina needs to get stimulated such that the image is seen as one. So these are two corresponding points of the retina. Now, although I am saying corresponding points, there is some degree of overlap that is allowed. So this overlap is known as Panam's area. So what is the function of this Panam's area? It is not a structural entity, it is a functional region in which, although some degree of squint may be present, it can be compensated by this Panam's area. So the rays of light need to fall in this area and not necessarily on the retinal corresponding point itself for the image to be seen as one. So although they may not overlap at the point of retinal correspondence, some degree of distortion is managed because there is a Panam's area. There is an area of overlap which compensates for it. So there is some degree of margin of error. So what does it mean to have non-corresponding areas on the retina? Let us take an example. Let's take the same image of the house. Suppose my left eye has a left lateral palsy. So if my left lateral rectus is paralyzed, it means my left eye is going to turn inwards because there is going to be unopposed medial rectus action. So the medial rectus has a resting tone that is going to pull the eye inwards, and consequently my fovea is going to move laterally, because if my eye is turning inwards, which is shown by the red arrow, my fovea, which is the red cross, is going to go outwards. It is going to go laterally. This is seen as a case of paralytic or concomitant squint. So now the image of the house is falling on the fovea of the right eye, which is the green arrow, because that eye is normal. But on the left eye, the image of the house is stimulating a point which is not the fovea. It is an extrafoveal point. It is a point nasal to the fovea. So these two points are called disparate points, where the same image is stimulating two dissimilar points of the retina. So the same image stimulating two different points of the retina. This phenomenon is called diplopia. So there are two basic types of diplopia. Suppose one or both of my eyes have moved outwards. There is an exotropia. So now light is going to fall on the fovea as shown by the solid black line. If you trace these lines backwards as shown by the dotted black lines, somewhere they will meet each other and eventually cross each other. So such a diplopia, where the two images that are forming on the retina when extended backwards cross each other, is called a crossed diplopia, which is a feature of exotropia. Exactly the opposite is uncrossed diplopia, where either one or both eyes have moved inwards, which is esotropia. Extending the lines backwards is never ever going to make them, either of them, meet to each other. So such a phenomenon is called an uncrossed diplopia. a feature of esotropia. Certain facts about diplopia: it is maximum in the field of paralyzed muscle. Let's come back to the left lateral rectus palsy of the left eye. The diplopia will be maximum when you ask the patient to look to the left, which is levoversion. However, certain conditions where diplopia is not seen. First phenomenon is of suppression, in which at the level of the cerebral cortex, at the occipital cortex, there is a suppression of the image that is forming. This is very often seen in long-standing strabismus. So childhood onset squint or congenital onset squints, suppression is very commonly seen. So in suppression, one image is completely suppressed, so there is absolutely no chance of having diplopia, because the prerequisite for diplopia is that there has to be double vision. There should be image in both eyes, whereas in suppression, you are suppressing one eye completely. And suppression is suggestive of amblyopia, which is an irreversible damage, irreversible reduction in vision. And the second place where diplopia is absent is abnormal retinal correspondence. For example, let's come back to that fovea, extrafovea example. One fovea is normal, whereas the other eye, because of a squint, light is falling at a place which is away from the fovea. So in small degrees of squint, sometimes when, in an early age, say in the first couple of years, the neural system has that plasticity to sort of compensate for this, such that the extrafoveal point starts acting like the fovea. This point will never have perfect vision. The vision will always be subnormal, but there will be no diplopia, because now there is an abnormal retinal correspondence that has developed. This new extrafoveal point has started acting like the fovea. So now there is absolutely no diplopia. Okay, now let's consider one more scenario. The same example, the house image is forming on the fovea of the right eye and an extrafoveal point of the left eye. However, do remember that the left eye fovea is still free to have an image of some other object falling upon it. There is no restriction for that. So that image, say for example, is the tree, which is shown by the red line, and the red cross shows the left fovea. So now the left fovea has an image of a tree, whereas the right fovea has the image of the house that is forming on it. So two different images are forming on corresponding points of the retina. So each fovea has a different image. So this phenomenon, where two different images form on corresponding points of the retina, is called confusion. Confusion leads to a phenomenon of binocular rivalry. In simple words, there is a competition between the two eyes to establish a dominance. Which eye's image will be seen more clearly? Because now both fovea are showing two different images, and both fovea are the points of maximum visual acuity. So which eye will show dominance? So there is a competition that happens between the two eyes, and it keeps oscillating between one dominance and the other. So there are three basic types of rivalry. First is the contour or shape rivalry, in which sometimes, as shown in the example, sometimes the house will appear clearer, sometimes the tree will appear clearer, and it will keep oscillating between each other. Color rivalry is also seen. For example, if the two fovea are shown two different colors, one is shown the red and a green and the right is shown the green color, for example, then sometimes the red will appear clearer, sometimes the green will appear clearer. And there is also a luminance or a brightness dominance, in which two different intensities of light shown to the two different fovea. Sometimes the brighter one will appear clearer, sometimes the darker one will appear clearer. So the only clinical feature that you need to remember in diplopia as well as confusion is nausea and vomiting. This happens because the CNS gets disturbed, and it is more often seen in confusion as compared to diplopia. Suppression is a phenomenon seen in both confusion as well as diplopia. If the fovea of one eye gets suppressed, then confusion is removed, because now if only one functioning fovea is present, there are no two different images that form. If only one fovea is functioning, the other is shut down by central nervous system suppression, then there will be no confusion. Exactly opposite, if the periphery of the retina undergoes suppression, then diplopia is removed, because only one image of the same object produces a response. The other response, which is falling on the peripheral retina, is suppressed. So as a phenomenon, it can be seen in both confusion as diplopia as well as diplopia. It depends where the suppression happens. That takes care of this concept. I hope it is helpful and useful to you. Please follow us on Instagram at eye.excel. We have a Facebook page which you can follow to stay in touch. Please subscribe to the YouTube channel to stay up to date with the latest videos. Let me know which other videos you'd like me to cover, which topics you would like to be discussed. As always, thanks for watching. Stay safe and good.